the money directed to them. They have brought over a number of people from the UK. Jackie Dillon, the chairperson of the Hearing Voices Network in the UK, is in Galway next week doing training. I'm going down. It's about disassociation and trauma, I think, next week. They have Rachel Waddingham. They have Rufus May, a psychologist who also has lived experience of hearing voices, coming over. And I'm not aware that that kind of training is feeding into the traveller community, or broader than that, and that you're actually challenging what type of services we're offering. And coercion does feature. And just, David, I'm kind of disappointed in a way that I was at Geneva with Pavley Point for the Economic, Social and Cultural Rights examination of the Irish state. But there's the Women's Council of Ireland have actually gone out of their way to bring a huge psychiatric conference here next year, at the very time when women particularly are trying to speak out about forced treatment, detention, drugging, even ECT. You don't have the right to make an advance healthcare directive. So Pavley Point are listed as a partner for that. And I'm not sure, is there a broader questioning of the approach and what that actually entails? So I know David probably doesn't speak for Pavley Point, but it's just, I think there needs to be a broader questioning of what we're offering people.
Thanks very much. First of all, I mean, I'll take the kind of two points together, because they touch on the adequacy of services for homeless people and other minority groups, and I totally agree. I mean, the point around the smear testing, not having an address is a terrible barrier for all sorts of services. And it proves again that our policies and our service provision are made for those who do vote and those who have most influence. And what's been done in the homeless services at the moment with regard to health is totally inadequate. And it's like, Austin and doctors and Safety Net are trying to, it's like fighting an uphill battle. And the emotional health you bring up, the mental health, in the survey that we did, the biggest thing, the most stark and horrific results were all on emotional health. Not emotional health, mental health, which would be it would include. And while there's, there has been some things done positively, like there's a psychiatric team for a homeless psychiatric team, for example, but they see the most severe psychiatric people with psychiatric conditions. They don't see the 60% with depression, which is obviously made worse, and anxiety because of the circumstances. And it's not clear what services that people can go to, and key workers who are working with people in hostels don't know, and there is a need for training, and those recommendations were definitely made. There's a huge need for training in that whole area. And with regard to the cancers and the addresses and the smears, that they're and the forms, even the medical card form is really difficult. We've just recently set up a clinic in Brewimeshire, which is a hostel for, it's the Cold Weather Initiative. It's basically, it was opened in November, and it's basically as an alternative to people sleeping out on the streets at night. But our doctors have started doing smears there, but like half of the people coming through there don't have medical cards. And obviously without access to health in the most unhealthy condition that you can be in, which is living on the streets, your health is only going to get worse. But there are some services doing smears and things, and I can give you that information. But it's hard to find, and it definitely isn't adequate.
Do you want to come back?
Just very briefly, I don't speak for Pavley Point, and I'm not associated or a member of Pavley Point, so I don't know what conference or organisations they attend or get involved in. It's their own business. But just on a general question, there have been obviously there are local organisations around the country, there are travel organisations. Again, I haven't given statistics here because I'm assuming that people can read, and the internet is fantastic in terms of looking for statistics or whatever. Most of the travel organisations that are doing quite good work have stats and statistics up on their pages that address sort of population numbers and figures. But when you bring up the issue of suicide, I mean, it is one of the reasons, one of the major concerns. And again, there's lots of analysis to why it happens, but for me it's indicative. I mean, when you look at sort of the suicide rate of any group, and whether it's community and within the travel community, you know, it's young males who are a high risk of suicide, which is reflected across Irish society generally, perhaps. But when you start looking at why one particular community has such a high risk of suicide, I mean, to me it indicates a crisis. It indicates a crisis of identity and everything else. How you deal with it, obviously, in terms of service provision. Again, it comes down to what we talk about in terms of resources and whether there's resources there to provide the appropriate psychiatric services. Having said that, there is, you know, many travel organisations who are trying to address the issue within the community, because it is a crisis. You know, and you know, there's some very good counselling projects, and you know, the Travel Counselling Service is doing Trojan work with very little funding. So it's always a question of resources and where those resources are being put into areas. But certainly, you know, figures for the travel community in terms of suicide are frightening, and it indicates to me a crisis. How it's addressed, I don't know. I mean, it seems from your own question, there's an element of, well, you have one particular view of how it should be addressed. Pavy Point are obviously something else, and you don't seem to agree on it. So, I mean, I can't answer for Pavy Point what they attend or don't attend. That's up to themselves.
Nuala? Oh, sorry.
Hello, my name is Foluke. I'm one of the Uncle Sam's students. My question is to Fiona, and I just thank you, first of all, for being a very strong lady, you know, giving the account of your career, that you must have been, you know, a very strong person, witnessing a lot of horrific truth about life. And bringing it home to Highland, like you said, I wonder, now that you find out that there's a shocking truth that the health of the poor are in the hand of the very small number of rich people, and there is nothing, I think, that we can do about that. I wonder if there's something, because I heard you talking about clinics or something like that now. Maybe you can divert your attention, or the attention of your group, to empowering the poor people to take their own health into their hands. Because it seems we're reaching a brick wall on relying on the government. Even people with medical card are getting like a chicken chicken treatment, just like a battery treatment. I've witnessed some people with cancer, from diagnosis to treatment and to death. I've witnessed that, and it's very horrific to find out the type of treatment that have been given. If you have a health, you know, if you are in PUBER or VHI or something, you will get a very different treatment compared to people with medical card, and what sort of treatment were offered to them. That something that doesn't work, even the tablets that you get from your GP if you have a medical card, is different from the tablet that you get if you are from VHI or PUBER, or you know, from the other private health something. It shows how the big difference between the rich and the poor, and what sort of treatment even you get, if you get any. Now, my question to Fiona, if you could, is could you enlighten the poor people on such a simple procedure on how to take care of their own health, rather than relying on the battery treatment of the government? I read something recently about cinnamon and honey, what do you call it, lemon, something that the pharmaceutical companies have already hidden from the public eye. And some people know the truth of how to even take care of your health and well-being, and it's something that can tackle even serious problem that is within our fingertips, but we're not being informed or rather trained to use certain things to take care of our health rather than relying on tablets and government treatment. Thank you very much. Sorry for taking your time.
Thank you. What I'm going to do now is, because we're running very close to the end, so I'm going to take any more questions, just if there's another one or two, and then we'll, Fiona first, and then we'll finish up with everybody having wrapping comments to make. So I think you wanted to make a point, Nuala.
Yeah. Well, can people hear me, or do I need a speaker? Can people hear me okay? Yeah.
It's on its way.
Yeah, thanks. Thanks. Nuala Kelly again. Two things. One, I just wanted to reflect back to something Colin was talking about this morning, and also the question that was asked from the floor about service providers and about public service provision and the need to observe human rights as services are being provided. And I think the new duty that's in the Human Rights and Equality Act of 2014, which obliges public services and public bodies to protect human rights, to promote equality and to prevent discrimination. I think that's a really important piece of legislation that should be governing services, and I think we do need to call it in more, and we need to become more aware of what it actually means in practice. The second part of that act, I think, is also that it's not just about the public bodies, but it's also about their staff, that they have to protect their human rights, promote equality amongst them, and also prevent discrimination. And I think that in terms of the way public services are being run down and being privatised and so on and so forth, that does impact the staff as well. And I think if you can protect their human rights as well, that it actually can change the culture of how they provide the services. So we need to start to explore that much more. But to go to then the point just about Pavy Point, I'm working in Pavy Point for the last year on a project that's about ethnic equality monitoring and about the need to collect data in order to be able to provide information to service providers and to others as well, so that the services can be appropriately provided. Now there is a much broader question about the nature of how the services are provided and also the nature as to whether they are culturally appropriate as well. But unless we have that data, it's very difficult to actually orient services towards the targets correctly. So that's one thing that I think needs to be done, and it needs to be promoted much more widely, both in terms of health, but also in terms of the nature of the kinds of services, to go to the point that's been made over here. And as for Pavy Point itself, I think also I'm not involved with all of the other work that's going on, but there are a number of projects. For instance, there's a men's health project there, which also has been dealing quite extensively with suicide, and as Davy said, it's working from the ground up. It's a community development approach, so it's not just about addressing service providers, but it's actually about trying to develop awareness and understanding about what your health should be and what kind of rights and entitlements you have, but how you also have some duties amongst your own population, your own community, to try and protect that. And there's a project on violence against women within Pavy Point as well. And as for participation in the international conference, I'm not part of that either, but I do understand that Pavy Point will be contributing to it. But I think because you contribute to an international conference doesn't necessarily mean that you agree with the way the services are currently being provided. I think it's an opportunity to try and critique them and to try to raise some questions and interrogate how the services are provided. And I think, going back to Davy's point, if the services are being provided culturally appropriately to all of the community, be it majority or minority population or ethnic minority or not, then they should improve the services for everybody as well. Thank you.
Yeah.